Good morning. We will start our news conference in just a few seconds. Okay, good morning and thank you for joining us for the City of Lubbock's COVID-19 news conference. Our panelists to give us updates today are Director of Public Health, Katherine Wells, Local Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. But before we get started, I'll remind everyone of our COVID-19 resources pages for citizens and businesses, and those are mylubbock.us/COVID-19 and mylubbock.us/LubbockSafe. So let's get started with Katherine Wells.
Good morning, and thank you for allowing me to update our residents with regard to our current COVID-19 situation here in Lubbock. I want to again assure our residents that the health department is working with our local, national, and state partners to make sure the community has the most recent information and guidance as we move forward. With this in mind, we want the public to continue to stay at home as much as possible, limit gatherings, practice social distancing when you're out, and continue to follow those good hygiene practices. Although we're opening up businesses, we don't want people to let their guard down. We need everyone to follow the guidelines to keep our case counts down. Today, I'll update you on the current number of COVID-19 cases in Lubbock County. The health department is reporting 507 cases as of yesterday. The department is pleased to see the number of daily cases remain steady. No additional deaths were reported yesterday. The number of COVID-related fatalities is at 43. And again, the majority of these are still associated with residents of nursing homes. Recoveries continue to be on track, and every day we're seeing more and more Lubbock residents who are now fully recovered. Over the last week, the health department has launched 2 initiatives. The first one was discussed on Monday, and this is the city-run testing site located at the Patterson Library. That site opened yesterday, and we will have our second clinic on Friday afternoon. The second initiative that was launched is an infection control strike team. With the help of medical students at Texas Tech, the health department is reaching out to all of our assisted living centers and nursing homes to conduct infection control assessments. The assessments are done to identify gaps that may allow COVID-19 to enter a facility. The health department will after we do this assessment, the health department will then work with that facility to address any gaps, and we want to do this before there's an active case. This is a preventative measure to reduce risk to our most vulnerable populations. We are excited that this group has already conducted 5 assessments, and more are scheduled for next week. That concludes my update, and I will now turn everything over to Dr. Cook.
Thank you, Katherine. I laud you for the work that you've done with the medical students and your team there at the health department to reach out and touch all these contacts to make sure that they understand what they're supposed to do when they're positive. And so that's fantastic for the community of Lubbock and the county. Let me just remind everybody as we open up the city that we still must not let our guard down. We must still make sure we keep social distancing, that we're washing our hands, that we're wearing facial coverings, and that if you're ill, please stay home and get tested and then return home until you have a negative test. Just be careful out there, as they say on the TV shows. The other thing I want to visit with you about is we have a number of individuals in our community that have lost loved ones. And this is especially trying for those individuals because of our hospitals having closed ICUs, in our nursing homes, having closed ICUs where somebody may have been on hospice and palliative care, and the family members were not allowed to be at the bedside of the individual that passed away. You can imagine how tough and how difficult that is for those individuals. We've not even really been able to allow funeral processions or those celebrations of life where they could celebrate those individuals' life. Please know that those times will come soon, but it just hasn't been able to occur yet. So reach out and touch those individuals, reach out and touch base with them, check on them. Just like it says, love your neighbor as yourself, love on them, check on them, make sure that they're doing okay. You know, I'm sure that many of you have heightened anxiety or heightened depression or even anger. Those are all normal grief reactions. But during this time where it's difficult to talk to people, difficult to solve those problems, reach out and touch them. Please encourage them to reach out to their clergy, their pastor or their preacher or their other loved ones, so that we make sure that they don't get overwhelmed with these feelings of anxiety and depression. Please know that the ones that took care of your loved ones are hurting for you as well. So check on your neighbor and check on your loved ones. There's a couple of phone numbers I want to give you. One of them is 211. That's all you have to dial, and that will connect you with somebody that can help you with your anxiety or depression. Locally, there's another number called Star Care, and that number is 740-1414. So 211 or 740-1414. Please check on your loved ones. This is a difficult time, especially those individuals that have lost loved ones during this COVID epidemic. Mayor, off to you, please.
Thanks, Dr. Cook, and thanks, Ms. Wells. Continue to appreciate your work. And I think on behalf of all our citizens, I want to just say thank you. I have people talk to me every day about how much they appreciate what you're doing. I'm excited that tomorrow we get to send more people back to work, that workers get to begin to serve us, that businesses begin to open, and then we get to start to phase in to warm up our economy. It's critical that we reopen safely. Remember, the health and safety of our community is a top priority, and that means both our personal individual health and our economic health. And we've got to find a way to balance this, and that's important. It does not mean that you don't stay at home. In fact, if you read the governor's order, it's very clear about that. And if you read the president's order, it says the same. The CDC guidelines remain very clear about staying at home and our social distancing and avoiding groups of more than 10. We need to continue to do that. That's important as we move forward. Now, the city council approved on Tuesday night the recommendation of our Lubbock Economic Recovery Task Force, and we introduced our Lubbock Safe program, we approved it that night, and it went live yesterday. In fact, Lacey shared the link, the address to that website, and if you didn't write that down, you can go to mylubbock.us and click on our coronavirus bar or spot. The very first link on the coronavirus page is a link to Lubbock Safe. Now, this is a voluntary opportunity for our businesses, our nonprofits, our hospitals, our churches to self-certify that they are going to hold themselves to a higher standard. And it's part of our guidelines that we've worked, that LERT recommended to the council. And if they do that, then we're starting to deliver these stickers today to go on your front door. It's a way for our citizens to know that you as an organization have taken extra precaution to provide for safety of your employees and of customers, parishioners, clients, whomever it may be that will be visiting you. I want to spend a few minutes and share my screen. You've seen our slides before. I want to remind you, these are available on our website, and I'm going to move. There's 8 of these, and I'm going to move through these with some pace. I know that, but you can see that we've got demographic data. That's the first 5 slides are demographic data, including our maps, which are updated on a daily basis. Remember, these maps are for the entire county. Okay, so I want to pause on these last 3 slides and remind you that these are the slides that we're most focused on. So active cases on a daily basis. You see that we've got a very good trend. It's flattened and has started to go down just a little bit. So active cases is simply total cases less recovered cases, less any deceased. Okay, so that's one of our metrics. New cases, another metric. It's the one that gets the most press. Now, we're in a good range on new cases. We had a little blip up yesterday, and that's to be expected. Remember that we've got 2 new testing centers in the last week. In fact, we didn't get Walmart start getting their results, even though they've been testing. We didn't get their results in the beginning of those until yesterday. We'll start to see the Patterson Library results tomorrow. Now, remember that statewide and in Lubbock, that between 8.5% and 9% of all people that are tested are positive. So less than 9 out of 100 are positive. But as we test more, we are going to find more cases. That's okay. We want to know where the people are. We want to do our contact tracing. We want to sort of build a wall around them, let them recover, and then they would actually have the immunities. And we also continue to test at more than twice the level of the state. So through yesterday in Lubbock County, we had tested 2.32% of our residents. Statewide, it had just been about 1.1% of state residents that were tested. More testing is good. We've continued to talk about that. That's something that we will continue to try to grow our testing opportunities. Okay. And I'm back. Sorry, I'm a little bit slow on my iPad doing that. So let me recap. Let's start reopening business tomorrow safely. Don't forget about Lubbock Safe. Remember the big 3. Wash your hands. Don't touch your face. Keep your distance. Follow our numbers online. Be safe. Be kind. Be hopeful. Come on, Lubbock. Let's get through this together. Thank you. Lacey, back to you.
Thank you, Mayor. And we now open it up for media questions. Our first one today is Karen McKay with KCBD.
Good morning. Mayor, my first question is to you. A lot of people are asking about this number for social gatherings, especially as we go into wedding season, and we know that you're relying on the CDC guidelines, which is no more than 10. But when we talk about the 25% of the capacity, does that mean if a group is in a larger building that they can move from 10 to 25% of what that building would allow? Help us understand what the number is for social gatherings, especially with big events and weddings coming up.
Well, Karen, first of all, I'm glad you drew the number one. You've sort of been down the list, and so
Thank you.
Good luck day for you today. So, event centers are not, to my understanding, are not reopened by the governor's action. So, once again, it's 25% of the occupancy of retail. With our big boxes, many of them have posted even lower than 25% occupancies. They'll continue to work on that. But the number around groups is 10. And we know groups of no more than 10. That's the guidance that we're operating under today.
Okay, next we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. I'm Christy with Latino Lubbock Magazine. First question is, given the disparities and the gaps to test minorities, there's a growing consensus that getting minorities tested will be an important part of getting communities back to work. As many Hispanics and people of color work in essential jobs, they're at risk of contracting and spreading the virus. So, will you add more sites beyond the current 4, especially in neighborhoods with high concentration of people of color?
Christy, thank you for your question. We are looking at expanding our testing opportunities. We're pleased to have 4 at the moment, and we will continue to work on more. We've reached out to a national group asking them to open one, and we'll continue to look for other opportunities to do so. I'm not certain about the disparities in by race in the actual bit of testing. Certainly our testing sites locally are open to everyone, and we encourage them that if they are sick and they feel like they have been exposed, to reach out to the health department, 775-2933, or to do the drive-up testing at UMC, or at Friendship High School Football Stadium, or at the Walmart at 114th and Quaker. And then certainly our testing center at Patterson Library is by appointment, and you get those by calling 775-2933.
Katherine, my next question is, how has since you're only taking folks by appointment at the Patterson Library, how has the response been? And do you anticipate testing? How long do you anticipate testing at that site and other sites?
Right now, our plan is to keep that Patterson Library site open as long as it's needed and as long as it's being used. I believe we tested 16 individuals through that site yesterday. There are plenty of appointments for people to make. We're also partnering with City Bus. So if an individual needs a ride to that testing center, you call the health department, make your appointment. We will pass that on to City Bus, and City Bus will pick you up at your door and bring you to that site.
Our next question is Jonathan Seaborn from Texas Tech University Public Media.
Hi, my first question is for Katherine Wells. The task force that you had mentioned earlier, was there anything concerning found in those first round of assessments, and how often should we expect updates from that task force?
That task force, we found a couple of things that just needed to be corrected with some of the facilities, and it's not a regulatory assessment. It's really to see what they could do to improve, to make sure they're following the screening, social distancing among residents, how they can increase hand washing or use of hand sanitizer. We can give a formal update when we finish that assessment. It's also in partnership with the Centers for Disease Control, and they're looking to have cities pilot this throughout the US, and Lubbock is one of the first cities to take on this initiative.
Thank you. And I guess this would be for anyone. A recent study was found that using cell phone data, that Lubbock residents have really only reduced their social mobility by about 25%, and graded the city an F for social distancing, which was down from a C in early March. Is there any plans for messaging around this issue to help address this as we open?
Yeah, I'll be glad to answer that question. We continue to drive our message home about staying safe, about asking people to stay home. We feel like we've had some success with that. I don't know about, I've not seen the report you're mentioning, but we'll continue to remind people that social distancing and staying home to the degree possible, other than their need for services, essential or non-essential, is the best path to take. I need to clarify something I said earlier too. And Karen, back to your question. I thought you were talking about the reception part of a wedding. Weddings or funerals inside churches are allowable under the governor's order. And there's some very specific guidance in the Put Texas to Work in his booklet about how to do that. And that's on our webpage also.
Okay, our next media question is Olga Aguero from El Editor.
Good morning. Can you hear me? Can you hear me?
Yes.
Okay. Good morning. Thanks, Mayor, for clarifying, because I was under the impression that like social gatherings could be the 25% capacity of a like a rental building, like some of these, weddings, quinceañeras, or that. So those kind of events can be held because of the capacity of the building. Say it's 250 capacity, so it would be 25% of the capacity of the building. Am I correct?
We'll have to get some clarification on that. That was not my understanding. That sounds to me, that sounds like a really bad idea right now. I mean, frankly, where we are, I can't support something like that, but we'll check and see. We'll post something. Okay. We'll push something out today to clarify that. I'm not the attorney.
I thought that was the clarification, or what was to like for restaurants,
But a restaurant's very different than a quinceañera, right? I mean,
well, it's kind of social. People.
But Olga, listen to me. Restaurants are restaurants. We're requiring 6 people at a table and distancing. I mean, quinceañeras. There's nothing about 15-year-olds at a party, in my opinion, where we're going to be effectively distanced. That's just one guy's. One guy. I've been to those. I understand, and yeah. That's my take. We'll clarify that later today.
All right. Okay? Sounds good. And then testing. I just want to really emphasize the importance, and just to spread it around in the community and let the community know that there is testing availability. Thank y'all.
Thanks, Olga. And there is testing availability, and we're testing it more than 2 times the rate of the state, and we'll continue to work on that. We want our citizens to take advantage of it.
Okay, our next question is Terry Furman with KOBK.
Good morning, everyone. I wanted to ask about how we're going to enforce these restaurants, these businesses that are opening. Is it up to the business to report that, or are we going to have people kind of floating around saying, okay, you're staying under your 25% capacity in a restaurant or a business, whatever?
Well, I've said before, Terry, it's a good question. We spend not much of our time worried about enforcement. Our citizens have done a very good job. We will continue to take people that are concerned about folks that might not be following the guidelines. We'd ask them to call the police non-emergency number and report those. Our fire marshals will be active in the community as they have been. We'll try to make sure people understand the governor's guidelines, but I don't foresee us having problems, because I think Lubbock people want to do this right. If we do, we'll deal with them.
All right, very good. Thank you.
Our next question is Matthew Stell from KMAC.
Thanks, Lacey. My first question is for Dr. Cook. Dr. Cook, of course, we are doing the slow reopen tomorrow. As a medical professional, do you have a little bit of nervousness about a possible resurgence, or are you pretty confident that you think we'll be all right?
Thanks, Matthew, for that question. Yes, of course, I'm nervous. I've been in the hospitals, I've been in the clinics, and I've watched our numbers, and we're doing a good job. But of course, two things are going to happen. We're going to open up Lubbock, and I worry that we're not going to maintain our social distancing, and we're going to get more people infected. Yes, I'm worried, but the good citizens of Lubbock can make sure that that doesn't happen. The other thing that will happen, and we'll see our numbers rise a little bit as we continue expanding our testing capabilities, we are going to find more positives. But that's not a bad thing if we can keep those positives from getting other people sick and other people positive. So that's the whole purpose of expansion of testing, is finding those individuals and asking them to stay at home and isolate themselves until 10 to 14 days. That's the whole purpose of testing. So I do expect, as our numbers of testing capabilities increase, we will see more positive cases. Hopefully, then those individuals must go home and isolate themselves so they don't infect anybody else.
Gotcha. Thank you, Dr. Cook. And
Bet.
one last question for Mayor Pope. Mr. Mayor, I kind of gets a little bit of clarification. When the governor's guidelines say 25%, and you've got a restaurant, for example, do you believe it's 25% of, let's say the fire marshal sets a capacity for that building? Is it 25% of that number, or 25% of, how many tables and chairs you have set up? What do you think is the clarification on that?
So our understanding of the governor's order is that employees do not count against the 25%. And then they can seat up to 25% of the total occupancy in their building, assuming they can do that and meet the social distancing guidelines that are part of his order.
Gotcha. Thank you.
Thanks, Matt.
Okay, our next is Freddie Kings with Fox 34.
Good morning. My first question is for Mayor Pope. I wanted to just verify, so will the city staff be verifying if businesses are in compliance, or did you say that the restaurants will be enforcing the guidelines themselves?
So what guidelines are you speaking of?
The 25% capacity and all of the other CDC guidelines.
Well, that's the governor's order, and we're following his direction on that. And as we have situations that we need to address, like I said a moment ago, if people feel like something's not being followed, we ask them to reach out to us. We'll check it out. We'll be in the community being active. We want to try to keep people safe, and we'll be working towards that end. But that's about as far as I can take that.
Thank you. I have one more question. As more businesses open and people are going back to work and schools are still closed, does the city have any advice on childcare?
Well, that's problematic. Frankly, the governor spoke to that a bit in his order this week. I encourage you to work with your child care. I was looking at a report this morning that said 19% of American workers rely on child care to be able to go to work, and many of those are our essential workers. Now, the child care for essential workers has been available through this period. It's a big part of going back to work and working with child care. And I know that I know the governor spoke to that in his order, and I'll let his order stand on that.
Okay, our next question is from Matt Dotre with Lubbock Avalanche Journal.
Thank you, Lacey. Hey, everyone. Mayor, we're talking a lot about opening up, and we're talking about big events. And if Lubbock sees a spike, does the city council even have the capability to kind of roll things back? Or are we just kind of at the governor's whim here? Like, what even does happen if we see a spike?
Well, we're under a statewide order, as you know, Matt, there is provision in that order for the governor to take action on a county by county level if need be. I think what we've seen on that is that they've not rolled it back, but instead sent more resources to those counties to try to help them address any kind of problem that might come up.
Okay. And then can you just talk a bit about what you're hearing and seeing from businesses? Like, do you think most restaurants and retail stores will be open tomorrow? And what's kind of been the response to Lubbock Safe? Do you think most are signing up?
Yeah, the response has been very good. I probably should have indicated that. The county judge has asked if we can extend it outside the city within the county. I think we've also shared it with the South Plains Association of Government group, which is 15 counties, our neighboring counties, the heart of the South Plains. So that's been very positive. Go ahead, Matt. You asked me something else related to that. I'm sorry. I've started on my sales pitch.
No, that's all right. Do you think most restaurants and retail stores will be open tomorrow?
I think, yeah. Thanks for had a Rick Perry moment there. I think retail will be open. I think they're very excited. Most of them are very excited about this. I think the 25% occupancy probably has a much doesn't have as much of an impact on them as it does restaurants. I think it's a bit of a mixed bag on restaurants. I think many of them will be open. I think some of them are realizing that this is maybe step one, as the governor talked about, of a phased reopening. And so, let's still do our curbside and take out, but let's start with 25% with the idea that if we do this well, we get to grow. I heard quite a few comments yesterday about some pent-up demand, and I would imagine our restaurants will have a good weekend.
Okay, our next question is Don Rubio with the Daily Toreador.
Hello, everyone. I guess as news was announced regarding tech reopening for the fall semester, I was wondering if there are any city efforts that are being discussed. Like, I know with the task force, there's an education committee. I was just wondering if there are any plans in the works as of now regarding easing that transition back to in-person classes for fall.
Yeah, Don, thanks for your question. First, our education subcommittee as part of ALERT is still working. They're working, Dr. Scrivenik's on that committee. There are other representatives of education on that committee. We will work with Texas Tech, Lubbock Christian, South Plains College, our school districts to safely discuss the ways we reopen this fall. But ultimately, that will be their decisions. They have governing boards and the right to make those decisions. We're going to be a good partner.
Right. That was it. Thank you.
Okay, we also had a media question sent in. Are there bilingual staff to do at the testing sites, specifically for Patterson Library?
Yeah, I'll go ahead and take that. Our goal is to always have a bilingual staff. However, that's not always available with the amount of staff that are also at the health department doing contact tracing. We do always have a phone translation service if I'm not unable to staff it with a bilingual person.
Good question.
Okay, well, that concludes our news conference. Thank you to our panelists and our interpreter, and thank you all for joining us. I want to remind you again of our COVID-19 resources websites for businesses and citizens. That's mylubbock.us/COVID-19 and mylubbock.us/LubbockSafe. We'll see you here next week.